Good evening, everyone, or good day, wherever it is that you are at where you're watching this. Today is day 5 of the Charms MediHelps Black History Month event, which we will be hosting all day. Not oh, that's the all day, right? It's
Yeah.
Monday. Well, we will be hosting all month. We will have a different speaker on all month. Why? Because as Carter G. Woodson says in his quote, it shouldn't be Black history, it should be Blacks in history. And so we have so many Blacks in history that are making the stride and doing such an excellent job at making sure that our community is a community that has all the resources needed for not just accessing healthcare, but ensuring that we have actually access, excellent access to healthcare. We want the best health outcomes. We don't want better health outcomes. We want the best health outcomes. How can we have the best outcomes? Well, we can start by having clinicians in the field who are doing the work, who are not only there to do the work, but are also there to actually explain to the patient, right? Explain to them what's going on with their health. Explain to them how they can get the best, the very best healthcare that's out there. And so tonight we bring Sheree Reed. Sheree is known as the patient care strategist. She is an expert in the MRI field. And you might say, well, you know what? What's an MRI? A lot of people don't even know what an MRI is. They go to the doctor's office, the doctor does an x-ray, and they think that's it. They think that x-ray is going to show them what the doctor needs to do, show the doctor what they need to do within a patient's body. I will give you an example. I was in a car accident, and they initially sent me to an X-ray specialist. X-ray looked at it and said, "We don't see nothing." I went to my doctor for the lawsuit, and he sent me to an MRI. The MRI came back and showed I had all kinds of stuff going on that occurred because of the accident. So it's important for us in our community to understand what is an MRI. Are there different types of MRI? Who does an MRI? What is it that we as a community need to know about MRIs when it comes to our healthcare? So while this subject is, for Black History Month and it's Blacks in History, this applies to everyone, no matter what color you are, no matter what socioeconomic background you have, all of that. It all pertains to you as well, because African Americans are not the only ones that are going to the doctor or going to the hospital or having these diagnostic tests done. We're not. But for the purposes of this month and for the purposes of this occasion, we're calling highlight to it because there are so many in the African American community that just simply don't know what they should know in order, once again, to get the best diagnostic imaging possible. So with that being said, I'm going to go ahead, first of all, and thank Sheree Reed. Hey, Miss Jacqueline Cox, thank you so much for joining us once again here on LinkedIn and here on Facebook. We truly, truly do appreciate you being here today. And once again, if you have comments that you want to add, please do go ahead and add those comments. Share those comments with us, because we want to be able to answer you and answer your questions that you may have in reference to diagnostic imaging. Add those comments. Share them. So with that being said, I'm going to go ahead and turn it over to Miss Sheree Reed.
Thank you so much, Sandra, for that warm welcome. I am pleased to be with you all tonight to celebrate my portion of Black History Month. And as Sandra said, this should be all year round. This is Blacks in Excellence, need to be celebrated all year round. My expertise is in radiology. I have been in healthcare for over 20 years. I have been a licensed radiologic technologist for 18 of those years. and I have my certification, and there was a typo, that certification in MRI. Have been certified for the past 12 years. I have worked in level trauma 1 facilities, trauma 2, 3 clinics, outpatient facilities, ERs, and you just kind of come across so many different walks of lives, and you'd be amazed at how many people have questions and just don't ask those questions. And I encourage everyone, not only in the Black community but in all communities, to ask questions. If you do not know, it is imperative, this is your health, it is imperative that you ask questions about what's going on, what's being ordered, what it means, what it's going to find, etc. It's very important that you ask those questions if you just don't know, or not, if you don't have all the necessary information that you need to have in order to make an informed decision. Please ask. My presentation is on patient safety and care in MRI. As Sandra stated, I am the patient care strategist. What we'll be talking about today is basically what is MRI, preparing you for your MRI, implants, surgical implants, and why we screen. And at the end, we'll have a Q&A. So if you have any questions, please type them in the comments, and we'll get those answered at the end of the presentation. So first things first, I want to start this presentation out with a question. How long do you think someone was stuck to an MRI scanner? This is a real situation now. How long do you think someone was stuck to an actual MRI scanner? So A is seconds, B is minutes, C is hours, D is for days. So if you want to take a stab at it, put your answer in the comments. This will be answered later on in the presentation. And it is shocking, but it happened. It happened more than once, actually. But put your answer in the comments and we'll get it, and I'll make sure I answer that later on in the presentation. All right, what is MRI? MRI, magnetic resonance imaging, is one of diagnostic imaging modalities used to diagnose or help confirm diagnosis or monitor diseases. There's some pros and cons to MRI, okay, just like with any other exam. I'm going to start out with cons first. Most people don't like that it takes a long time to get the MRI. You have people complaining that, their doctor sent them there for a 10-minute study and they have been there in the exam room for an hour. This is why we encourage to ask questions. You have to be very still during an MRI. During an MRI, if you move, the picture is blurry and basically we'll be starting over, and we'll talk about that a little later. You might experience claustrophobia. There is a lot of people who claustrophobia does not affect. There's a lot of people that it does. And a lot of people don't even know that they're claustrophobic until having an MRI. So those are some cons. Some pros, there's no radiation involved. Okay. A lot of people don't know that MRI is or does not have radiation involved at all. It's a big magnet. The magnet works with the hydrogen atoms in your body. And from there, it's a very complicated process, and it still wows me at times. But from there, it produces the images that comes across our console. But it does take a long time to do. And the images are very detailed. So depending on what your doc is looking for, it's the preferred modality. So, and a lot of people have to go through insurance. So, there's a process there. They have to have an X-ray first and have a CT before they get something specialized like MRI ordered. So there's the pros versus cons. Why it's important to hold still. So again, we won't know. Well, I say again, you won't know until after the images are taken, um, before we can see that the patients are actually moving most of the time. Unless you're moving your arms or legs, if you've coughed, if you're sneezing in there and the technologist doesn't see that, some of these images can take anywhere from 20 seconds on up to 20 minutes for some of the sequences. And the sequences are just a fancy word for pictures. Um, but it's important that you hold still because we won't know that you've moved until after that image is done. So you've laid there for 5-10 minutes, and then we come on the intercom and say, "Are you okay?" Well, you're moving, so we have to do this picture over. And if that happens a couple of times during your exam, you're looking at maybe a 30-minute exam, adding up pretty quickly on up to 40-45 minutes, just depending on what the doctor ordered. So it's imperative that you're able to hold still. So if you're not as comfortable as you can while laying on its table, for sure, it's going to be hard, it's going to be uncomfortable, but we try to get you as comfortable as possible. Pillows, cushions, a warm blanket, because it's usually cold in the hospitals or the radiology atmosphere, period. So we try to get you as comfortable as possible. That way you can hold still for your exam. All right, preparation for your MRI, what to wear and not to wear. So there's a lot of patients that come to have their diagnostic test, and they have on everything. They have on all of their jewelry. They have on metal snaps. They have on jeans. They have on everything on their person, belts, etc. You want to come for your MRI exam comfortable in a cotton outfit, let's say jogging outfit fit if you want to. That way you don't have to have a warm blanket because you're going to be already warm in there. The magnet tends to warm up during your exam if it's a longer exam. So you want to dress comfortably in cotton, okay? Tennis shoes as well. You don't want to have steel toe shoes on because that could pose a problem, right? It's metal. So come dressed comfortably. So no jewelry, no medication or nicotine patches. Those nicotine and medication patches can warm up and administer more medication or nicotine, uh, the medication for the nicotine. It can alter the medication and administer more than you were supposed to get, basically. Diabetic monitors or insulin pumps, you have to remove those. And we get fussed at a lot for having to tell the patients they have to take those off, but those could pose a problem. So those need to come off. Wigs, bobby pins. I have went round and round with a lot of women who do not want to remove their wigs. There's a lot of wigs that have either the metal clip in the back or within the wig itself, or metallic fibers within the wig. If you're having a brain MRI, we won't be able to see anything. So, and if those bobby pins are in there, they're going to come out. The machine, the magnet will pull them out, and we have issues. Okay. Walkers, canes, even the wooden canes. The wooden canes are usually lined with a metal pole in there. Dentures, even partials, metal. They're all metal. Your cell phone, your smart watches. If you wanted to be smart after the exam, you want to take that off before you go in the MRI suite. Keys, coins, bras, etc. If you are unsure, ask the technologist, please. All right, anxiety attack. Again, let's talk about claustrophobia. So again, a lot of people don't know they're claustrophobic until actually having to have an MRI. So if you suspect that you could be claustrophobic, I suggest that you talk to your doctor before going to have your MRI. Because if you get in there knowing, oh, well, maybe I can tough it out, and then you get in there and like, nope, pull me out of here, then you've had to reschedule, you've wasted your time, and now you got to come find another day to come back. Talk to your doctor before coming. That way they can give you meds to help relax you, to help get you through the MRI. MRI screening forms, those are done and or should be done um, by every imaging department. Every MRI you are to have, you're supposed to have an MRI screening form completed. They're supposed to be done every single time you have one, unless you're in the hospital and there has been no change, no surgeries. Um, uh, and you maybe just had an MRI the day before that, we could still use that same MRI screening form. If not, we need a new MRI screening form done. And that just tells us if you've had any implants done, if you had any surgeries that they may have left metal inside of you. We'll ask these questions several times, because you'd be amazed about how many people don't remember being shot in 1972. And the third time you ask them, do you have any metal in your body anywhere? And they go, oh, yeah, I was shot in 72. And I mean, it's baffling to me, because I'm thinking, how do you not remember being shot? I feel like I'd remember that, but people forget. So it's important to know why we ask these questions over and over and over again. There's two different technologists that may be working, and of course you may be asked the same questions by the technologists, and it's for that reason alone. People remember different things, or if someone says it differently, then it jogs their memory. So don't be offended if you're asked the same question several times for your MRIs, for your safety and ours too. All right, scenario here. A woman checks in for her MRI appointment. After completing her screening form, she insists she has no metal on and asks if she could just keep her street clothes on because they are made out of cotton and spandex. Is this okay? No, it is not okay, because they seem to have, I don't know, conjured up every way possible to make it difficult for MRI technologists to do our jobs. There are things called magnetic garments here. These garments are for treatment for a lot of different things. I want to say a couple of which is for arthritis. But the patient may not know that these garments or undergarments have metallic fibers in them. So a lot of facilities are having patients remove everything. We have gowns, we have scrubs that you can change into. And again, that is for your safety. As you see here, there's some magnetic eyelashes. I was thrown back when I actually saw that commercial come on, magnetic eyelashes. So the liquid has metallic fibers. You stick the eyelash on that and it sticks, but the magnet will pull your eyelashes off. Okay, I've seen it happen. So let your technologist know if you have anything that's questionable. And like I said, a lot of facilities are just moving to, we're not even going to take the chance. We're going to ask that you remove everything and put on our gown and or scrubs, because this is what can happen. This lady had her jogging or her exercise gear on, not knowing there were metallic fibers within the pants, within the jogging pants, and it burned the inside of her thighs. Second-degree burns are the most reported incidents in MRI. So please, please, please remove your clothing. If the technologists see, we should be policing that MRI room. If that's a great technologist, They will basically pat you down, question everything. I had a lady pretty much argue me down about her sports bra, and the clips on the back of her sports bra were metal. And I tried to tell her that they were metal, but she's like, no, 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 they're plastic. They're plastic. So I had to go get a metal wand to wand her, to prove to her that it was metal. And of course, she was surprised and took the sports bra off. But they're making a lot of garments with metallic fibers. And it's just safe to go ahead and remove those clothing and put on a scrub. Put on scrub pants, a top, or a gown. All right, implants. So if you've had to get an implant or two, these implants are usually pacemakers or defibrillators for your heart, aneurysm clips in your head, coils, filters, stimulators, pain pumps. Again, the medication patches and nicotine patches, insulin pumps, silver wound dressings, if you've ever been shot before, etc. These implants are necessary to inform your technologist on whether or not you can have that MRI at that facility. There's a lot of people that don't know that certain implants have conditions on those. And we'll go over MRI, but the difference between MRI safe, MRI conditional, and MRI unsafe. But there are a lot of people who don't know that just because they had an MRI over here at this facility does not mean necessarily that they can have an MRI at another facility. And that is a lot of the arguments in the MRI suites with the technologists, because the patient will say, I just had an MRI a year ago and at XYZ facility, and they had no problem doing my MRI. Why can't I have one now? Okay, so there are certain conditions that some implants have that are different per scanner. So there are conditions that for some implants that meets a 1.5 scanner. There are certain implants for a 3 Tesla scanner, and that's a little more powerful scanner. And the manufacturer of the implant should have the instructions, and we'll have that information because once we are informed about what kind of implant you have, we look up the manufacturer and see if that particular implant can undergo an MRI, and to what degree it can undergo an MRI. So just because you had an MRI at another facility does not mean you can have an MRI at all facilities. And it also doesn't mean that you can have an MRI on any part of your body, because there are some implants, for example, a neurostimulator in your back. There's little controls that comes with those, and it tells you what part of your body you can or are allowed to have an MRI of. And some are saying head only, some are saying head and body. So again, if you don't know, of course, you need to ask your doctor and or the MRI. And I say doctor, usually most doctors don't know. But call the imaging department that you are scheduled to have your MRI a few days before, and just to ask the technologist the questions that you need answered. We have those answers. We get a lot of patients come in with the wrong information and upset with us because their doctor told them something completely different. Call the imaging department directly and say, can I speak to one of the MRI technologists? And we can tell you specifically, yes, this can be done at our facility. It can be your brain MRI can be done, but your abdomen cannot be done with that neurostimulator, etc. So it's important. If you have any of those questions at all, call ahead of time and we can explain that to you over the phone. We love getting those questions. We love getting those calls because it actually prepares the patient a little better, which makes you a little more easy when coming in for your MRI. All right, so the difference between MRI safe, MRI conditional, and MRI unsafe. So MRI safe. So anything that's marked with MRI safe means that you can go in the room, in the scan room, without there being any conditions. The magnet is not attracted to it, okay? MRI conditional, okay, means there's certain conditions that has to be met before you can have that MRI. Just in the previous example of the neural stimulator, okay, there are certain conditions. This patient can only be scanned for 15 minutes. This patient can only have their head scanned. There are certain conditions on that implant that has to be met, okay? For pacemakers and defibrillators, there is a whole team that has to be called for a lot of facilities. Now, in my experience, there is, you got to get in touch with the representative for the manufacturer of that implant. They will come out and put that pacemaker or defibrillator in MRI mode. Okay. Now, they're moving, a lot of facilities are moving to where they're training the technologists to do this. I don't agree with that. I feel like that's outside of our expertise. But a lot of facilities are moving to where they're teaching the technologists how to program these pacemakers and defibrillators and put them in MRI mode. It's all remotely done through a one of the manufacturers' laptops, and they of course dotted their I's and crossed their T's in being able to do this remotely. So technologists are able to do this safely, but I just don't agree with it personally. But it has to be, the manufacturer rep has to come out for a lot of facilities still. A nurse has to be present to monitor your heart rhythm, your oxygen rate, et cetera, respiratory. The nurse has to be present for that. We have to get a radiologist to clear a chest x-ray a lot of the times. And again, this is not for all facilities, but for a lot of them, they are requiring a chest x-ray prior to having an MRI just to make sure the leads or wires within that pacemaker is still in the right place, per se. Those are conditions, right? MRI conditions for pacemaker defibrillators. And then, of course, MRI unsafe means it should not go into the MRI suite at all. This is what happens when patients and or family members that are not screened properly. Here to the left is a picture of a gun stuck to the magnet. I'm not certain where this particular incident happened, but to the right here, we have 3 or 4 men attempting to pull this gun off of the MRI scanner. It's not going to happen. Okay. So it's important that going into, if you like to conceal your handgun and take it everywhere with you, you need to let the technologist know that you have it, for one, and the technologist should know for sure, if they're doing their job, to basically do a pat down of you if they're changing you out of things. Let your technologist know that I have this concealed weapon, so we can tell you have to lock that up because it cannot go into the MRI suite. Let's see. All right. So here's 4 different stories here from health imaging. First one, a woman shot in buttocks by her own gun during an MRI appointment. Craziness. This happened in the U.S. The wound was superficial. She was treated and released. But again, if you're not making your technologist aware of what you may have on your person, then this can happen. Second story, inmate and prison guard stuck to the MRI magnet at an unregulated site. This happened in Arizona. The tech reportedly told the guard not to remove the metal shackles around the inmate's waist. The guard then attempted to help, but became stuck herself when her gun came in contact with the magnet. So now you got two people stuck to the magnet. Okay. And the technologist apparently was not trained because he or she should have known that all of that has to come out. For the inmates that I have done MRIs on, the guards, these are usually in or trauma one facilities, level one facilities, and the guard usually know the routine. You take all of that stuff off, and if the shackles, they usually put zip ties or aluminum shackles. Aluminum is a metal that is not attracted to magnets. So, but you don't have the cuffs that the inmate comes with. You have to take those off. Otherwise, this could happen. Third story. Toddler suffers second-degree burns from an MRI and no one knows why. This is baffling to me. I think the parents are in I think they're suing the facility, of course. I believe that story happened in Australia, but there is a lawsuit filed against the facility. And they've got to do their investigation and figure out what happened there. The fourth story, Massachusetts patient suffers facial fracture after a freak accident during an MRI. This happened in Massachusetts. Apparently, a metal linen hamper was moved into the MRI suite. Okay, the wrong metal linen hamper. And when the patient laid down, the metal linen hamper flew across the room during the man's exam, striking him in the face and fracturing his facial bones. All of this can happen. It has happened. These are real incidents. These are real stories across the world and more importantly here in the US. And if we're not paying attention, and if the patient is not being forthright, we will overlook a lot of things. So please, please, please inform the technologist of anything that you may have on you. And it's up to, if you're a healthcare worker yourself, it's up to the technologist when allowing people into the MRI area. Okay, there's different zones in MRI, which I don't have time to go over, or I didn't include it in my presentation. But there's zone 1, 2, 3, and 4. And the fourth zone is the actual MRI room. Well, of course, you have staff members come to the MRI department all the time, but they have to be screened as well. So and everything that goes on in MRI, it has to be wand, it has to be tested, if you will, to make sure it's not ferromagnetic, right? It's not attracted to the magnet. All right, so this picture here to the left, a false leg stuck to the MRI scanner. And below it, you have the staff trying to pull this leg off of the scanner. Now, I'm not certain, of course, we see that it happened in France, but I'm not certain if the patient had already laid down and the magnet pulled the leg off, or how this happened. I'm not certain. Again, let your technologist know that you have a false leg, because and it's up to us to also pay attention, because if you're changing your patients out of their clothing, we should see this. Okay, but please inform your technologist of anything that you were not born with. And I'm not certain who came up with that, but I love that. Inform your technologist with anything you were not born with. This story to the right, a lawyer in in where was this at? Mumbai, I believe, in 2014, shot by his own gun. He was assisting his mother apparently to have her MRI. And I don't think it was this gun that's shown that looks like a AR-15 or something. Like surely somebody saw that, right? But I think it was a handgun, and he in the MRI room, the gun went off when it got close to the magnet, and it shot him. So we cannot just stop at the patients. If we're having family members help us with their loved ones in the MRI room, we have to screen them as well. It's not just if you're the patient. Anybody coming in contact with that magnet in the area, in the vicinity, needs to be screened. Okay? And here are 4 images. When I tell you this is happening so much here lately, or it's just being reported so much here lately. The picture to the left is a chair at the back of the MRI scanner stuck in the scanner. So that's not an MRI conditional or safe chair. Then you have what looks like a wax machine or the a waxer or whatever, stripper maybe, stuck to the magnet. So at no point should whoever's cleaning floors should ever be in zone 4. As technologists in most of the facilities I've been to, we are in control of cleaning the MRI scan room. Okay, the technologists, that's part of the technologist's duties to clean that scan room, because we know what we can take in there, and what we know what should or should not go into the room. Supposed to, anyway. The third picture is a wheelchair. Okay, there are MRI safe wheelchairs. This is apparently not one of them, and it's stuck to the magnet. The fourth picture, we have some pants. This particular patient had ankle weights in his pants. He was wearing ankle weights, right? So he did not inform the technologist because he didn't think. He thought it was sand in those weights that he was wearing. Turns out, nope, there's metal in there. Came right up out of those pants. And I say that jokingly, but I swear to you, if you have any, and if, of course this is on the technologist, she should have had the patient remove everything, including pants, and change that patient into a gown or scrubs if they're not a lot of men are not comfortable wearing gowns. So we have scrubs for them to change into if they're not comfortable with the gowns. But things like this can happen. All right, to answer that question, 2 staff members actually spent 4 hours stuck to the MRI scanner. Imagine being stuck to an MRI scanner for 4 hours. Okay, you have several people over here trying to get those staff members off. This happened in 2014. This happened in another country, by the way. 2 staff members were pinned to the scanner after one of them brought an oxygen tank in the MR room. And get this, the reason it took hours for them to be removed from the scanner is because the emergency stop that we have in our control area, okay, was not working. They hit it, it didn't do anything. Okay, it's supposed to demagnetize the scanner, quench the magnet, we call it. It is, but it demagnetizes the scanner, and the staff members would be released, but it didn't work. It did not work. So they spent hours stuck to the scanner until an engineer from the manufacturer actually showed up and was able to demagnetize the magnet. That should not happen. Okay. That's craziness. 4 hours stuck to the scanner. They actually had to treat them while they were stuck to the magnet. One suffered a fractured shoulder, and the other suffered internal bleeding. So they both lived, but they were traumatized, of course, after this incident. Horrible. It's imperative, and that's not the only incident where people have been struck by oxygen tanks. There's like 3 or 4. We've had dozens, and this is in the US, dozens of incidents happen where the staff member either got distracted and there's and allowed other staff members to go into the MRI suite with the wrong cylinder. And I don't know if you all have heard, but of course, about, I believe it's maybe now 20 years ago in New York, a little boy was killed. The nurse brought the wrong oxygen tank in there, and it went flying in the scanning room, crushing the little boy's skull. He died. This happens regularly, and it should not. We have to stop and pay attention to what all of our surroundings are, and we have to be aware of what's going in and out of the MRI scan room. All right, so there's been too many incidents, and we have to stop and actually ask ourselves, does this need to go in the scan room? Do I need to make sure my technologist knows about this before? Please, 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 if there is any question, tell us, give us permission to do a pat down, because there is a lot of people who don't know or who forget or don't think that this particular item that they have on, we'll do a visual pat down, up, take that watch up, take that off, up, take this off, and they're just not thinking about it. Okay. Be open to that, because there's checks and balances for a reason, right? There's 2 or 3 people asking you the same questions for a reason. So take a moment to think. And I call this picture here the baby thinker. This particular patient was pregnant. This baby is about 8 months old, ready to come on out there. And it looks like he or she is thinking of a master plan. So if you guys recall that statue, the thinker, I call this the baby thinker, because they're posed just like the thinker, that statue, the thinker. I love this image. So take a moment to think. Have I had any surgeries that they may have implanted any metal? Any surgeries, okay? And just be, if you don't think they may have implanted any metal with the particular surgeries, be prepared to list or tell the technologist the surgeries that you have had. That way we can say yes or no to any particular surgery in question of where they may have implanted something metal. Do I have trouble being in small spaces? And if so, do I need to call my doctor and have them give me something to help relax me? It's imperative, because you don't want to get in there and get halfway through an exam and realize you can't do it. I have had several patients have heart studies done. And for the facility that I was full-time at recently, our longest study was heart exams. That exam could take anywhere from an hour to 2 hours, depending on the patient's heart rate, depending on how well they were able to hold their breath. So you don't want to have to reschedule an exam that could take up to 2 hours and you're halfway through it. So talk to your doctor in advance to say, hey, I'm having this MRI done. I may be, claustrophobic, or I am claustrophobic. Can I get something to help me relax to get through the exam? We as technologists cannot give you any medication. We're not licensed for that. So ask your doc, the ordering docs that's ordering your MRI or your PCP, let them know that you're having this MRI and that you need something to help you relax. And do I need to use the restroom before laying on this hard table? Again, you don't want to get halfway through an exam and have to go to the restroom and have to start over. Okay, that's basically what has to happen. A lot of times we can, we may not have to start completely over, but depending on the exam, you may have to start over. You don't want that, right? So make sure that you're telling your technologist, hey, let me run to the restroom real quick before I lay down here. um, it will help you get in and out faster. Okay, and please remember that the magnet is always on. There is, just because you're done with your exam does not mean we turn the magnet off. The magnet is on, it's always on. So remember that, okay? And this is just a little cute picture I like. It says, "Did you remove your piercings?" As she is stuck from random parts of her body to the MRI scanner. Okay. So please, please, please remove everything from your person. Know that there is a method to our madness of having you do that. It saves a lot of time. It saves you heartache in the end. It could possibly save your life. Okay. It could possibly save you from getting burned or injured in MRI. Please, 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 if you have any questions before your MRI exam, get the facility's phone number and talk to the technologist personally so you can ask those questions if you're unsure. All right, we are to the end of the presentation. Sandra, if you will, please join me back. If you have any questions, if you had any and you posted them in the comments section, I can answer those for you.
And you, Sherry, thank you so much. I'm not seeing any questions, but I myself have some questions, and I also have some words of advice that I want to actually say. So I'm hopefully that you will be able to answer me. Renee Patterson, who is an RN, MBA, PMP, BCPA, as well as a doctoral candidate. She will be Dr. Renee within the year. I'm claiming it for her. Yes, I am. She's saying very true about the MRI, and so as a nurse, she knows what you should be doing, and she knows that patients need to know all they can about MRIs. And what happens so often, especially in the African American community, right? We as healthcare professionals are always hearing stories about how the patient is non-compliant, how the patient is not following orders. Well, if the patient doesn't know the orders, how are they going to follow them? If the patient doesn't know that there's a reason why they have to do this MRI and there's a reason why they need to remove everything from them, how are they going to do better? They're not going to do better. We're going to continue to have these issues where we're reading about, the under resourced, the vulnerable, disabled patients having such a hard time at being good patients or being what they classify. When I'm saying they, what the medical establishment classifies as good patients, well, we can't be good patients if we don't know.
That's
And
true.
so whether you're looking at this tonight or whether you're watching the video replay, know this, that once again, while this is African American month and we're putting this out here for African Americans to actually be able to understand the healthcare system, understand how things work, understand the stories, right? Sheree showed us stories and told us stories about how people got stuck to the MRI machine. 4 hours, an MRI machine, stuck to an MRI machine. Now that was the manufacturer's fault, but it wasn't actually also someone at the hospital's fault, Sherry, for making sure or for not ensuring that machine worked.
Mhm. Yes, that's on staff.
Okay, so that's
Um,
That's a staff issue, but it
Mhm.
wasn't a staff issue for those MRI techs that were there, the ones that got stuck, or was that a staff issue from another department?
So, um, ultimately, the buck stops with the technologists. Ultimately, we're
Okay.
in charge of the MRI suite. We're in charge of who comes in and out. We say yes or no. We have turned many people around, away because the buck stops with us when it comes to that scanner. Somebody has to be able to say no or yes. Now, with that being said, I feel like there needs to be more help in the MRI suite. A lot of times it's just one technologist. And I believe that's is possibly the cause for a lot of these situations. You're only one person. So you're trying to set up the exam, and or you're trying to help the patient, or you're, in the control room trying to prep for the exam, and the nurse calls herself to, helping you out and wheeling that patient right on in, and unbeknownst to the technologist, and there you go, there's an incident. The patient and her, the staff member may be stuck to the magnet, because you cannot just wheel a bed into the scanner room. That patient has to be transferred to an MRI safe. And most of or not most, but there are some magnets that actually the table can detach and pull out, and we can transfer the patient away from the scanner. But when it's just one technologist, it's kind of hard to do that. So it there needs to be some help.
So my question to you is this: is it possible for the patient, when she calls to schedule an appointment, ask if there's going to be two technologists, or is there a way that the patient can ensure that there's two technologists, or is that just simply something that's just not done?
That is facility driven. Okay. That's different from facility to facility. And it usually depends on how big that particular facility is. They're not equipped to hire two MRI licensed technologists to run the department. So a lot of times it's just one. I've come across some trauma one facilities where there's more than the one technologist, but that's at the bigger facilities, right? If you're at a smaller facility, there more than likely is just going to be one technologist. It's just up to them to say, hey, nobody goes in or out without me, period.
And it's when you brought that issue up just a minute ago in reference to it really depends on the facility. I'm sitting here cringing, and I'm sitting here literally I'm sitting here like, I'm not upset, but I'm questioning something, and I'll tell you what I'm questioning. We hear so often in the healthcare field about value-based care, and we hear so often about, the hospitals that fall into that value-based care. And a lot of times that value-based care is our community hospitals, who are the smaller hospitals who cannot afford to add another technologist, try as they might. They can't afford to hire a technologist, another technologist, so they had two technologists in the office or in the facilities. So, I beg whoever it is that's policy, who's ever behind looking at the policy stuff, to take a moment to unravel what you're looking at, and take a moment to look at what what you're focusing in on. When you focus in on value-based care, and when you focus in on that TIF money, and make sure that that money that you're giving to these community hospitals, that AKA value-based care hospital, that you're giving them enough to actually hire the people that need to be hired, so that patients going to see them, going to seek care from the facility, and as well as our outpatient centers, that are not affiliated with a hospital. Patients going to those outpatient centers, they need this information. But patients that are going to facilities that are getting TIF money, that are being classified as value-based care, aka community hospitals. Make sure that in that conversation and in that discussion, and while you're sitting there crunching numbers, you're crunching numbers not just for pharmacy, but you're crunching numbers for radiology, your diagnostic testing, your routine visits, whatever you're doing. Make sure there's enough money there. And more importantly, make sure you are allotting to the hospital facilities enough money so that they can hire technologists such as Sheree that are trained to do the job right. Because plenty of patients, especially in our African American community, and I'm sure on a global basis, are going to facilities not aware of what the technician should know. The technician, a lot of times, especially if they're being paid pennies on a dollar, they're not even sure what they should know, right? They're just going by what's in the book. And a lot of times you gotta look outside the book. Like you said, Sheree, the technologist should be patting the patient down. What's on the patient? What's in, what does the patient have on? We go around, we wear clothes. You brought up a good example with the exercise clothes. We wear clothes, we don't really know what those materials are that are in those clothes. Nobody's telling us, nobody's talking a lot of times because we just don't know. So those that are in the policy field and are looking at that value-based care, make sure you're doing a deeper dive into that value-based care and what TIF money and how it's going to be allotted and what it should be allotted for. Make sure that you're doing a deep dive deep dive look into, okay, well, we gave them money for this, but now do they need money for that? Because most value-based care facilities need money for everything, right? They really do need money for everything. So I'm so glad that you brought that up, and I'm certainly glad that you were able to come on tonight and actually tell us what we need to know, because nobody, listen here, people, especially my African American community, nobody is coming to save us if we don't know and we don't do what we need to. One, find out. We don't do need what we do. Those of us that are healthcare professionals, and we don't do what we're supposed to do, which is to uplift, educate, empower, and engage our community into what they should know, how they can be, because we want each person to own their own healthcare journey. But if they don't know, because we're not telling them, because, well, we just don't feel like it, we got to move past that. We just don't feel like it. And we got to get into, if you touch one person with the information that you have, at least as one less person that will go to the emergency room or to, have an MRI diagnostic outpatient test done, that doesn't know, they now know. They now can share that information. You can't make them share it, but at least that one person's life, they actually now have the tool to actually be able to say, hey, look, this is what I know. And as a patient, please, please, please be transparent, because as you can see from the pictures that Sheree showed us tonight, the only person that you're hurting when you're not transparent is you. That's the only person that you're hurting, is you. And as a result of you hurting yourself, guess who else hurts? Your children, if you have children, your spouse, if you have a spouse, your siblings, your community. These are all people that, because you're not doing what you're supposed to be doing, that you're hurting, right? When you're not transparent, when you like, oh, I think I could tell them this, but I could get away with that. What? I mean, what? I mean, just like she showed us the picture of the guy whose gun came out. They in there trying to get the gun out. Well, you should have said something to begin with, that you had a gun with you, or yeah, I got this implant, or I got this bra, and if they ask you to take it off, when I gotta go take diagnostic testing, I try to wear as least as I can. That way, when I get in there, I can just go in, get what I have to have done, and come out. Same thing with everybody else. Go with what your basics, so that you can come out without having a problem. Because in the end, if you don't take care of it, you only got one body. Everybody, you only have one life. You can do what you want to do with it, but guess what? It ain't coming back. Once you leave this here earth, you ain't coming back. You don't even have a chance to come back. So do what you must to take care of yourself. Do what you must to, be, with the person. Like we tell people as an advocate, I tell everybody I can, do not go to the doctor by yourself. Take someone with you, whether you go to the doctor or hospital, take someone with you. Make sure that person that you're taking with you, though, like Sherry said, make sure they ain't got nothing on them either. Because ain't no, it makes no sense to take somebody with you when they ain't up on the up and up. That hurts you. That literally hurts you when you go in with somebody and they ain't saying nothing, they ain't talking, they ain't saying nothing, and you got to have a test done, and it's like that. Before we go, I do want to ask you two questions. Now, there's been talk of open MRIs. Are open MRI, what is an open MRI? And is it just as safe as a closed MRI, which is the machine that you get squeezed into? Is it just as safe as someone, as a open, as a closed one, right? And in reference to the open MRI, does it pick up like the material, like the metal, because you're not closed, you're in an open space? Does it pick up the same?
Right. So just okay, so an open MRI is really not open per se, only one side of it's open, so it's shaped like a C. So because they're your closed MRI is a whole circle, right? The opener one are shaped like a C, right? So one side is out. It's a magnet just like the closed MRI is, right? You still have to do your due diligence in removing everything that is not safe to be an MRI. You're still supposed to remove everything off of your person. Um, the drawback with open MRI is the quality of imaging. Most doctors do not prefer open MRI because the quality is not up to par as with the closed MRI. So that's the major difference there. But a lot of claustrophobic patients do prefer open MRI over closed. So,
Okay. Thank you so much. I appreciate that. And then before my last question to you is this. You have a trademark and you have a patient care strategist trademark. Can you tell us a little bit more about what the patient care strategist is and what the patient care strategist does?
okay. Um, Thank you for asking. That is an excellent question, Sandra. I appreciate that. So over the years, okay, I've been in healthcare over 20 years, and I have come in contact with people of various backgrounds, various cultures, and I have perfected patient care in a way that enables them to relax and heal faster, share more information with staff members, and make them comfortable in an uncomfortable situation. I started my own business, Impeccable Patient Care, and became the lead consultant for that company. I have alongside a couple of nurses, one technologist that will be on the consulting team. So, what we do, we can go to healthcare programs to teach them, the healthcare students, how to interact and connect with patients on a personal level. They say that great patient care, great bedside manner does wonders in healing, okay, in the healing process. It's not just what they do in the hospitals, what tests they order, what medicine they give. It's how you treat people, it's how you care for them. So if we can enable and actually spread the word that quality patient care matters, then we can help heal a population. I've had to stay with my mother in the hospital, and I've actually saw great patient care and horrible patient care. And I had to have a discussion with those nurses This woman is trying to heal. So if you're out here making all kind of noises at the nurse's station, she can't rest properly. If and you have to know that the nurse's station is set up by patients' rooms. So it's thinking, past your job. It's thinking past that. We are given a very important task, and that is to help heal sick individuals. And I take that job and responsibility very serious. And that's why I created Impeccable Patient Care. And that's why I'm now the patient care strategist. Thank you for asking that question.
No, like I stated earlier when we started, it's, Carter G. Woodson said it the best when in his quote, it's blacks in history. One that "in" is a word that was taken out, just like equality is taken out of equity. But the "in" is taken out. And when I read that quote, I was like, wow, he really meant for this not so much to just be a month where we just celebrate African Americans, but where we highlight and we showcase all of the wonderful gifts that we have and all the wonderful ways that we can each in whatever spectrum we are. But for this purposes, in reference to healthcare, all of the brilliancy that we have where we can carry our people forth. We don't highlight it, it stays hidden. Who does it help? Right? It doesn't help our people. We can't stand on the back of and the shoulders of our ancestors if we're not helping people, because we know that they help. We have Carolyn Coleman that says, yes, take someone with you to your appointments. And she is correct. Take someone with you to your appointments. Don't go alone. But before you take that person, have that conversation with them. Hey, what are you carrying on you? What do you have on you? So that so that maybe they need to sit in the car or sit out in the hallway or whatever it is that they need to do in order for you to actually receive the best health care possible. But at least you'll have someone with you so that you'll need to, should you need to say anything or should you need to get some help, you have it. We have Patricia Pearson that's also responded, and she said this was great information. I agree, because she told me some stuff that I didn't know, right? I mean, I really didn't know, and I'm sure that there are others that will be looking at this later that will say the same thing. They'll be like, "Wow, I didn't know all of this." So, Sheree, could you tell us all what is? Well, before you tell us this, I do want to say this. Tomorrow, which is day 6, February day 6, which is day 6 of the month long Chums Medi Health Foundation Black History Month event, will be recorded. It will not be a live recording, so I will have it recorded. I will actually put the link up for it. It's all about preventative care. The speaker for tomorrow couldn't she had other outstanding things that she had to do, so she wasn't able to she wasn't able to do a live, but she wanted to make sure that the thoughts and the processes that she had was in fact told. So we will actually either put the day 6 link up tomorrow at some point in time, or will definitely be up on on the morning of the 7th, which will actually also follow at 6 p.m. We'll have another live event coming live to you. So please be on the lookout for that. But Sherry, before we close out for the evening, what I do want you to do is to tell all of us, including myself, what it is, your parting words as far as going for diagnostic testing and having that diagnostic testing done, and also, if they wanted to reach out to you, how could they reach out to you for, whatever reason? Maybe it's to come in and educate their class on MRIs, or, do you do it, online? Can you do an online class? Can you come, do you have to be in person? Can you do it online? Exactly how they can reach out to you for whatever their needs might be.
Okay. Thank you. And great question. Yes. So I encourage any patients or would be patients before having their MRI exam. Like you said, there's a lot of people that just don't know. please, please, please call the facility that you are scheduled to have your exam done. Ask to speak to the technologist. Okay, a lot of people are going off of what their doctors say, and they are showing up to appointments upset. They're showing up because they were misinformed about what all their exam entails. There's a study that's called a defecogram, and it's, we have to insert ultrasound gel rectally and vaginally. And a lot of people don't get that information from the doctors. So when they get to our facility and we have to tell them that, imagine learning for the first time at your exam that you're going to have to get some ultrasound gel inserted into your body. So please call us ahead of time. We are here to help. We're happy to help. Call us and ask us all the questions that you need prior to your exam. And if at all possible, yes, leave the people that come with you in the waiting room, because we discourage actually other people going to the MRI suite just for those reasons. Okay. But make sure you call the facility and ask all of those questions ahead of time. And yes, we are open as Impeccable Patient Care is open to do Zoom classes. We show up in person. And it's not just on MRI or radiology, it's patient care. Okay. It's quality patient care that is seriously lacking in healthcare. And I've seen some of the students that come out, they have no idea how to interact and connect with patients that are hurting, that are, in some cases, you will be the last face they see on this earth. It is important to know how to interact and connect with those patients on a deeper level than just passing meds and or starting an IV and or doing an MRI. So yes, we are available for online classes. We are available for in-person classes. You can reach me directly at info.impeccablept, P as in Paul, T as in Tom, care.health. That's I make sure I said this right. Info.impeccableptcare.health. And you can reach me on LinkedIn. Just look up my name, Sheree Reed, or on Facebook. You can call me directly. My phone is listed there on LinkedIn. Yes, you can reach me on any of those platforms.
Thank you so much. And there was actually one more comment that I do want to read, and it's from Dr. Cassandra Williams. And Dr. Cassandra, as I say all the time, if I say it wrong, please blame it on the head and not the heart, because my heart is so with you, and I'm so thankful that you are, back out checking to see what information the panelists, my senior subject matter experts, panelists have actually come up to say and to share with us, all of us. While this is once again an African American event honoring African Americans and their health, we do want to make sure that all patients are aware that this does not just apply to African Americans, it applies to all patients. And she says the examples and the pictures drove your points home very well. I agree. I mean, you came with it. I asked you to come. You said, Sandra, no problem. What day can you want me there? And not only did you come, but you showed up with a passion. You showed up with the care and concern that all of us as African American clinicians should carry with us and should put forth when it comes down to treating our community. And she says it's so many things to consider. Like I said, I learned a bunch. I learned as a patient myself, and as someone working in the patient field, in the community patient advocacy field, I now have information that I can share with patients that ask me about MRI or ask me about any type of diagnostic testing. Is look, don't ask. I love my doctor. I really do. I haven't excellent. I wouldn't trade her for nothing in the world. My medical team, period, right now, I love each and every one of them. God has blessed me to have a beautiful medical team, right? But I know this, they don't have all the answers.
True.
I know this, that they might give me an answer, but I'm going to go look it up to see if what they're saying is true. I know this, just like my medical doctor is my medical doctor. If I need a specialist, I need to go see a specialist. The same thing with you making appointments for your MRI. If you're going to get an MRI done, do not ask your doctor for everything that the technician is going to need, because the chances of them knowing are slim to next to none. You heard it from a technologist herself, which is a specialist in the radiological field. They are not going to know. Ask them, can you give me the phone number for the technology department, or where you're sending me for, can I have the number for that technology space? If you call them as a patient and they don't know the answer, guess what you need to do? Just guess. Just take one guess. Just take one good guess of what you as a patient, or you as a caregiver of a patient, or you as a loved one as a patient need to tell them to do. If you should call them, the technology department, the technologist, and they tell you they don't know what you're supposed to do, run.
Right.
Run, because you do not need them taking care of you, because the chances of them giving you the best health care out, getting to you the best health outcome ever, is not going to happen, because they don't know their job. Because they should know their job. You should stop going to people that don't know their jobs. If you're asking them questions and they don't know, and they're not even willing to tell you, you know what, let me look into it and get back to you, and then they don't call you back, you got to go chasing them. You don't need them. There's too many of us out here that are good quality practitioners that want to be able to help you and want to get you to that best health outcome. You don't need them. Run. You're gonna get it. Just run, just run, just keep running until you find out how to actually make sure that it works. So I thank each one of you very, very much for listening, whether it's tonight or whether it's some other day. I'm hoping that you get information. And once again, Sheree is, on LinkedIn. She's on Facebook, as well as, if you need to, reach out to me and say, hey, Sandra, can you give me the information for Sheree? I'd love to reach out to her. I'd love to, maybe they're doing a program themselves and they, want you to speak, to their program attendees. She's all for it. If it's information that has to be given out, she's the one that you want to actually ask when it comes down to the diagnostic field, when it comes down to patient care. She's an expert at that too. So with that being said, once again, we will be on pause tomorrow for our live event, but please do look forward to the information that will be pre-recorded tomorrow and posted on my not my web, well, on my website, but also will be posted on LinkedIn here and on Facebook as well. And with that being said, I want to wish everyone a very good evening or a very good day. Take care.